office.
That's right.
I don't think you're eligible,
I'm afraid not. Me and Arnie, yeah. Good afternoon, everyone. Thanks for coming down to Kwinana, and it's good to see you all. Just to provide you with an update in relation to a range of topics in relation to COVID-19. And WA Health is reporting that there are no new cases of COVID-19 overnight, so the state's total remains at 1,096. WA Health is monitoring 4 active COVID-19 cases in hotel quarantine. The pilot of the military plane that flew into Perth yesterday has now been confirmed as a false positive. The false positive result occurred in Queensland, and the test was rerun at the state's reference laboratory, where it is now being found to be negative. So the pilot was also tested in WA, where he has also returned a negative result. So it's now up to the ADF to arrange forward plans and onward journeys in relation to the flight and its crew. Yesterday, a Melbourne man who allegedly breached border restrictions to attend the AFL Grand Final returned an inconclusive result to COVID-19 on the GeneXpert device. A PCR test has today returned a negative result for COVID-19. The man also returned a negative result for COVID-19 following a test in the Northern Territory on the 15th of September. He has been fully vaccinated. The man has also returned a serology test today, which is consistent with someone who has been fully vaccinated. The man's Melbourne friend, who also attended the grand final, and a woman in their company have so far tested negative to COVID-19. The 2 men remain in custody, and all 3 are now subject to a 14-day quarantine arrangements. Now onto the ship, the Stolt Sakura, a tanker currently off the coast of Western Australia. Yesterday, the captain notified WA Health that 12 out of the 22 crew members had returned non-negative rapid antigen tests for COVID-19, and most of whom had mild to no symptoms. Our authorities are working with the shipping agent and usual biosecurity channels to determine the next situation, the onward travels of that vessel. But obviously, as you appreciate, it's a live situation. The vessel was due to arrive in Fremantle at the end of this week. Now onto the vaccination program. Our vaccination rates were at 65.6% of those aged 16 and older who have received their first dose, and 46.5% of those who have received both doses. More than 2.3 million doses of the COVID-19 vaccine have now been delivered in Western Australia. I just want to make a few observations in relation to the vaccination program. As a state, we've had to pick up the slack and implement more of the rollout than we were responsible for. We've seen that in how we've prioritised aged care workers, increased rollout for Aboriginal and Torres Strait Islander communities and the like, to get the higher vaccination rates. And I want to thank everyone who's been involved in this program in relation to the rollout in WA. Their contribution is so crucial in protecting Western Australians and keeping us safe. This is for everyone on the front line, administering vaccines, everyone behind the scenes as well, be it in the state-run clinics, in the GPs, in the Aboriginal medical services, or our respiratory clinics and pharmacies. I know that 19 or 20 GP clinics are desperate to be able to also deliver the vaccine. And I know many Western Australians would find going to their GP much more convenient in terms of receiving the vaccine. However, the expansion of our GP network in relation to the COVID-19 vaccine has been impeded by federal government bureaucratic red tape. It's disappointing to say the least, and ridiculous that they're being held up by approvals at a time when it's so crucial to roll out the vaccine within Western Australia. In WA, we have around 700 or so GPs which administer other vaccines such as the influenza year in, year out. And they could administer COVID vaccines as well if they were allowed to do so. Only 400, however, have actually been given approval by the Commonwealth Government to roll out the COVID-19 vaccine. So there's greater scope for the primary care centres, such as our GPs, to provide the vaccine in Western Australia and significantly lift our vaccination rates. In other jurisdictions, we see a much higher penetration of the GP clinics in relation to the vaccines. Typically, we see a 60-40 split. That is, 60% of the primary care sector providing the vaccines to around about 40% of the big state-run vac centres. In Western Australia, the situation is almost reversed, with over 50% of people receiving their vaccines from the big vaccination centres and just over 40% receiving their vaccines through their GP or respiratory clinics. So we can do better. We can lift our vaccination rates if we get more GPs with the opportunity to actually be a member of the vaccination team. And it's vital that they be allowed to do so, because it's only by getting a greater penetration of vaccination points that we'll get a bigger lift in vaccination rates. Any questions?
Just on vaccine supply, it's all well and good to say that there needs to be greater GP penetration, but at the moment, supply is outstripping demand. There's 250,000 vaccine appointments currently available till the end of the year through GPs, more than 80,000 in 5 weeks at the state-run clinics.
Yep.
So there's vaccines sitting there that people apparently don't want.
Well, we think it's as much a situation of providing greater convenience for people to get to their local GP, the GP that they're probably familiar with and are used to receiving medical advice and attention from. If we expand the network of GPs that are available to give the vaccine, we'll see an increase in the vaccination rate.
Are there like black spots then in terms of locations where there are no GPs that can give vaccines, and if so, where?
I haven't seen that analysis, but obviously one of the key outcomes that we're looking for in terms of getting the Moderna to the pharmacies is that in our rural and regional communities we have a very low concentration of GPs. And as a result of that, a low take-up rate of the vaccination program. So making sure that we can get it into our regional areas is vitally important. In other states across Australia, we have around about 96 GPs per 100,000 head of population. In Western Australia, that's down to 79. So you see, if we have a smaller spread of GPs within Western Australia and we don't have enough GPs actually administering the vaccine, that puts us further behind the 8 ball in terms of getting our vaccination rates up.
Is another factor the border? Would you accept that the relative safety afforded by WA's strict border is actually backfiring and reducing vaccine demand?
Well, we've certainly been successful at keeping Western Australians safe. And we understand that that may have led or leads to a sense of complacency or just hasn't led to a sense of urgency by people in Western Australia to get themselves vaccinated. But Delta will come into our community. It's inevitable that ultimately it will come into Western Australia. And so people have to do the right thing. They have to get themselves vaccinated. There's plenty of opportunities to do so. You can walk into the clinic at the showgrounds this week and get yourself vaccinated. So please, everyone, do the right thing, roll up for WA.
So how do you break down, the vaccine commander said this morning, there's 20 to 30% of the population that are in that group that haven't yet got the vaccine. Given they've had so much time to walk in, do the clinics, what else is needed? More campaigns, more advertising? How do you break into that group?
Well, I think it's a number of things. Obviously, more campaigns are important to make sure that people are aware of their obligation and their opportunities to get themselves vaccinated. We also need the vaccine commander, and he would have told you a little bit about this, around getting our vaccine teams out into smaller communities, within cultural communities and isolated communities. And that's why we've had the Vaxathon in Broome, where we just made sure that we got to as many people as possible. You would have seen working with the mining industries in the Pilbara, in Tom Price and Paraburdoo, and we want to continue to do those sort of things, different sort of parts of the program to make sure we get to everyone in good time.
The vaccination rate among young people in WA is far below other states and territories. Is that a particular concern, and how do you get people in their 20s or late teens?
Yeah, anecdotally, for instance, I'm told that you had teenagers rolling up to vaccination clinics in New South Wales demanding AstraZeneca. They were wanting anything. So obviously they had a much greater focus in terms of their health and safety because of the outbreak in that particular state. So we need to continue to get everyone to do the right thing. We need adults to explain to their children, their family members, how important it is to get themselves vaccinated, because we're not safe until we're all safe, and we need everyone to roll up for WA.
What happens if WA doesn't even reach 80% double dose?
Well, we will reach
What happens if
80%
we
double
don't?
dose. And as a result of that, we'll then be in a position to rely less upon public health social measures such as masks, 2 square metre rule and the border to protect Western Australians. But we will get to 80%, and we will make sure that we keep Western Australians safe, and that when we do release measures such as the border controls, then that we'll only do so when it's safe.
What happens if we don't? Because on the current
Well,
numbers, it is actually hard to see how we're going to get there.
Well, it's hypothetical to speculate that we won't. At the moment, on the current trajectory, we will get there by the end of the year. But we want to make sure that we get there in a way which is deliberate and steady, and that we can actually get to everyone in due course.
Why doesn't modelling yet exist for when the state's expected to reach 80 to 90% vaccination rate, when that's the state government's target?
Well, sorry, let me just answer this another way. The people inside the Department of Health are working on the modelling in relation to what we need to do once we get to those vaccination levels. Also running different scenarios about different vaccination levels. And that's informing us and informing the Premier in terms of our current campaign to encourage everyone to get vaccinated.
You mentioned a lack of urgency.
Sorry, where should we go?
When do you think it will reach between 80 and 90?
Look, we think we'll get there in December, and that will obviously be an important time of the year. The National Cabinet will also be considering the arrangements towards the end of the year, so that's an important milestone to reach.
You mentioned a lack of a sense of urgency, particularly among younger West Australians. Would setting a real target of 80, 85, 86, whatever it is, between 80 and 90%, setting an actual target, create a sense of urgency?
Well, I think as we get higher into those numbers, we'll see the range of options open to us become more apparent, and the National Cabinet will also be considering what other measures that it wants to put in place as well. So when we get to that point, we'll be in a position to communicate with the West Australian community about what they now need to do next in order to stay as part of the Stay Safe campaign. Look, we want to make sure that everyone does the right thing, gets themselves vaccinated. It's just so important. And we know that there's a level of complacency out there. We know some people are finding it inconvenient. If we get more vaccines into our GP networks, if we get more GPs being able to deliver the vaccine, and if everyone does the right thing, we will get there.
The Feds have said that once the state hits 80% double vaccination, COVID support payments get cut off. Will that influence WA's decisions on things like citywide lockdowns once we get to 80%?
Well, no, it won't, because we want to actually make sure that we do the right thing to keep people safe, rather than necessarily relying on the Commonwealth for handouts if, in the event that we don't manage any outbreak properly. But it's disappointing that the Commonwealth would make these sort of threats on the basis of jurisdictions that aren't managing their outbreaks. But Western Australia will continue to play its role to make sure that we support the other states by keeping our mining industry open, to make sure that the federal government has the revenue to support the other states, and we'll make sure that we do the right thing in the event of any outbreak in WA by keeping West Australians safe.
So would the West Australian government provide those sorts of payments itself in the event of an extended lockdown?
Well, look, we don't believe that we will need to have an extended lockdown, because we believe that we'll have the necessary measures in place to keep people safe. And the best way that we can keep people safe as we get to this part of the campaign is for people to get themselves vaccinated.
What are those necessary measures? Post 80%, you did mention just before when I skipped over it, but the masks, 2 square metre rule, the Premier had said he didn't want to bring restrictions back in. Have you now settled on what restrictions will have to come back in when the border reopens?
No, we need to see what the reality is once we get to that stage of vaccination. as well as we need,
Masks,
yeah.
2 square metre rule, will
Yeah,
that
so
be in place?
that's right. Yeah, so just let me finish. So we will need to see what the reality is when we get to that level of vaccination. We also need to see what the situation is in other states, and therefore what role the borders might play in terms of keeping people safe. But don't forget that under the Doherty modelling, they always anticipate the fact that we would have the 2 square metre rule, that we would have mask wearing, things which people in other states take for granted as a normal part of everyday life, and things that people in Western Australia now see as part of a distant memory and not something which is part of everyday life. So we do have some issues to confront, but the way that we will confront them best by making sure that we get ourselves vaccinated.
Minister, we've been informed today that there was a class action lawsuit launched in court against Ramsay Healthcare, nurses at Joondalup Health Campus who are against the no jab, no work mandatory policy. How concerning is that people who work in our healthcare system are against what the government put in place there?
Well, it's appalling that someone who commits themselves to a career of care and attention and the health of people that they care for in their patients, who immunise, vaccinate and medicate their patients on a daily basis on the basis of medical science, then on this issue decide to step away from the medical science and pretend that it doesn't exist. The fact of the matter is that the vaccines are safe. The fact of the matter is that vaccines will protect people from severe illness and possibly death. And I just want to emphasise that these are the same nurses that year in, year out are required to get influenza vaccines, they're required to get pertussis vaccines, they're required to get tuberculosis vaccines, they're required to receive a range of vaccines to protect themselves and the patients that they care for. The COVID-19 vaccine is no different.
Is this a mindset that you're aware of across, or is it a small group?
Look, we know that there are people out there who, for some reason, have divorced their lifelong commitment to medical science from the point of view of COVID-19. It's disappointing. We'll deal with it, but we'll make sure that we retain the safety of our staff and the safety of our patients as uppermost in our priorities.
On the border breaches to attend the AFL Grand Final, it does beg the question, how many others have penetrated WA's border simply by lying?
Well, and it's particularly disappointing that it would appear that the efforts to get into Western Australia for the Grand Final were premeditated, well considered and meticulously carried out. So the fact of the matter is this is not someone acting on the spur of the moment. This is actually an effort to undermine Western Australia's public health measures to keep Western Australians safe, and that's really disappointing.
Do you know how many others might have lied their way through WA's border?
We can but speculate, and I wouldn't want to. But obviously, the police have done a great job in making sure that we kept any border breaches to an absolute minimum. And I'm really proud of our police and the health department in cracking down on the people that we have been able to discover have breached those arrangements.
Did they make your hard border look soft?
No, I don't think they did. I think they emphasised just what a strong stance Western Australia takes in protecting the safety of its people.
How can you stop that if it's as easy as lying?
Vigilance. We have to continue to be vigilant, and that's the reason why these particular people are now stand accused of breaching our border arrangements, because we made sure that we meticulously monitor the people who are coming into Western Australia and monitoring the declarations that they make as part of their G2G pass applications.
Are you feeling a sense of relief that WA has avoided what could have been a significant COVID scare with that negative result?
Yeah, look, just imagine if that had turned out to be a positive result and these people had been allowed to move throughout the Western Australian community. And what that does emphasise to me, what that does is really sparks in my mind is the importance of everyone getting themselves vaccinated, because it just takes one slip up. It just takes one individual to come through to spread the disease to someone who then pass it on to someone else. And then we're in a situation of managing an outbreak. The best way that we can manage an outbreak is to be prepared, and the best way we can be prepared is to be vaccinated.
What's your view on allowing rapid antigen testing at home in West Australians?
Look, I'm a big fan of rapid antigen testing and the other emerging technologies in relation to rapid testing. Again, going back to the science, they talk about test, trace, isolate, quarantine. As TTIQ has been some of the important factors in terms of managing the disease in addition to vaccination. So I think in the future you'll see a situation where, let's say someone's travelling to Western Australia or travelling to Australia, we'd be expecting them to be vaccinated, we'll be expecting them to return a negative result, and we'd probably be expecting them to undertake a range of rapid antigen tests or other rapid tests to monitor their health in the early days of their arrival. So rapid antigen testing is going to play a big role in everyone's lives, whether it's going to the airport, going to a major event, going to a major complex in Western Australia. I think people need to understand that rapid antigen testing is going to play a big role in everyone's lives.
With regard to the footy-related border breaches, are you able to clarify, is it alleged that they had come into WA within the 14-day period from Victoria, or had they been in the Northern Territory and South Australia for the full 14 days?
Look, I won't try and characterise the case that's been made out against them, other than the fact that I understand they made false declarations, and some of those declarations were on the basis of false documents.
Yes, but pertaining to the public safety risk it presented, that 14-day period would have been crucial had they been in Victoria.
Correct, yes.
Within that 14 days
yes,
before WA.
That's right. So my understanding is they misrepresented the amount of time that they were in the Northern Territory, and then were therefore allowed a G2G pass to come into Western Australia.
Can you just give us any clarity around the men who came through South Australia? We know that it was alleged falsified documents for travel through the Northern Territory. Was it a similar story for the South Australian entrance? I don't know if you've had clarity on
Yeah, look, I think it was similar, but not necessarily the same. Again, I understand it's on the basis of false declarations.
I mean, at what point in the vaccination drive will WA no longer be considered highly susceptible to an outbreak? It's terminology that the Chief Health Officer uses often in relation to the border.
Indeed, and the Chief Health Officer makes two observations in relation to our susceptibility. One, the fact that we have very few other public health social measures, such as 2 square metre rule, masks and so on, and the other is our low immunisation rates. Obviously, his concerns around immunisation rates will start to be allayed as we get above 70, 80% and so on, but I won't speak for him in relation to at what point he makes a judgment about that.
Just on the Antonov, the false positive, the pilot, are you still continuing with tests of the rest of that crew, or are they all now released from hotel quarantine?
Yeah, so my suspicion is because obviously they're going to be working with the ADF and aren't subject to our rules as far as that's concerned. But given that they've now decided that first crew member was a false positive, so that he's not a risk to the rest of the crew, that the crew will be allowed to on-travel from this point on. But obviously that's an arrangement they'll have to make with the ADF and the Commonwealth.
And the ship, yesterday, the Stolt Secura, yesterday I thought it was 11 positives, today it's 12?
I can I can only repeat the notes that I read out earlier. So
Because yesterday it was definitely 11.
right, okay, well, as I said, my advice at the moment is that it's, I think it was 12 out of the 22, yeah.
Possible to just check whether that's one new one or whether it was meant to be 12 yesterday?
I don't know. We'll certainly check that out. Yeah.
Can I just clarify as well, are you expecting that ship to
12 out of the 22, yeah.
to be able to berth at Fremantle, or we want it to stay out of, not berth at a dock and sail away as quickly as possible?
Well, you've heard the Premier and me say on previous occasions our preference would be to turn the boat around and it heads back from where it came. But because it is a vessel at sea, it is subject to the Australian Maritime Safety Authority's call. So we'll work with the Commonwealth authorities. But if they make a call that it has to travel to a Western Australian port to be cared for, well then we'll manage them in the same way that we've done on with previous vessels.
And not just Victoria's extreme border, but also just generally the border. Hearing from a number of health workers having trouble getting through, including one from Canberra that's medium risk. Given the shortage of nurses currently in our hospitals, shouldn't nurses be getting prioritised, even if the border is extreme risk, Shouldn't we be bending over backwards to get nurses into WA?
My word. I mean, if there's any healthcare workers that are trying to come to Western Australia on an arrangement with an employer or potential employer, they need to speak to the health department or their employer. In 9 out of 10 cases, it's simply a matter of them not having the right documentation. So for any worker for which there is an acute shortage, doctors, nurses and so on, we want to bring those people in. A good example, for instance, is one that we've brought in today, an anaesthetist who's offered to work in the Kimberley. Hen's teeth. Really important people to have working in our regions.
From Victoria?
I can't remember if it's Victoria or New South Wales, but we're bringing them in because that's the exemptions or the arrangements we can make.
Does it
under
surprise
this.
you to hear that nurses are having trouble even when they find the COVID line? They're being told nothing can be done?
No, it doesn't. There is a level of confusion out there around this stuff. So we try to provide as much information to nurses and others when they're preparing to come to Western Australia. Crucial amongst that is that they work with the Department of Health and have letters of authority from their employers to say they're coming to work in the health system in WA.
And sorry, Ross,
Yeah.
completely non-COVID question, but ABS figures out today, the suicide rate nationally and in WA has gone down overall, but 15 to 24-year-olds has increased dramatically in WA compared to, in 2020 compared to 2019. What can you attribute that to and what needs to be done about it?
Yeah, well, look, we know that there's obviously a lot of anxiety in the community, particularly throughout 2020 and 2021. We know that this period of time, anxiety and mental health issues have particularly impacted young people. So it's obviously devastating news in relation to the growing suicide rate in that cohort, but it's not surprising. And that's why Minister Dawson and myself are working closely together, particularly with the Child and Adolescent Mental Health Services, to see what resources and policies they need to help them do their job better. Thanks very much, everyone.
Thank you. Blue shirt.
I was more just
That was-
looking at the hair in 1985.
This is my first political campaign. The Student Guild at Murdoch.
Did you win?
I did, actually, yeah.
Otherwise you wouldn't frame it, would you?
I just like how old it is and what you had to do in those days to get that, that sort of writing. Because you used to have to get stencils and you scribble them out to actually line up all the
Is it a
letters.
shirt?
No, it was hidden somewhere for a very long time.
You threw
But
it
the
in
blue
the
shirt
air.
was in the 2008 campaign. And